am here with an important PS. I hope that you will take what I say and do something with it. If it's for you, great. If it's not, take it or leave it. But I had to send this message out. So, about 3 or 4 years ago, I went to see a holistic doctor. And I just wanted to get my blood work done. I just wanted to know from her some supplements that I could take that would be helpful on my wellness journey. She did exactly that. We had a great visit, and actually, my insurance doesn't cover visits with her, so I pay $300 plus whenever I visit her out of pocket. But it was worth it. One of the things she told me about at the end of our visit was a coronary calcium test that I could take for free that was being offered. And I said, wow, you're kidding me. I said, oh, okay. I said, what does it do? And she told me that this particular test is a quick scan of your heart and your chest area. It lets you know how much calcium is in your arteries. And she told me that if you had calcium in your arteries, then you more than likely had plaque in your arteries. The quicker you discover it, the quicker you can do something about it. So I thought, for sure, this is a test that I want to take. And so I did. Let me just give you a little bit of information. Let me just share this with you. For women under 50 and men under 65 with obesity for 10 years or more, researchers have reported that there was a 25% to 60% increase in the risk of heart attacks and strokes. So, if you are obese, if you are overweight, there is a high chance that eventually you may be headed for a heart attack. And here recently, I have had several friends that have had loved ones or spouses or just people that we know that have had heart attacks, and they were seemingly healthy. And so I thought, what can we do to prevent it? We know there are some things you can do. Lose weight is one. Obesity is a huge factor in your risk for having a heart attack. But another thing you can do is taking tests and seeing how things work in your body whenever possible. And so this is one of the reasons why I'm letting you know about this test. This was 3 or 4 years ago. So when I first took the test, it was free. I also have taken the test again. I took it in June. It was covered by my insurance. Now, they say if you don't have insurance, your insurance doesn't cover it, the test can cost up to $200. Now, when I took the test 3 or 4 years ago, my calcium score was zero. Zero. Thank goodness. It was zero. And I was overjoyed when I got that news that it was zero. When I took the test on June 3rd of this year, 2024, it was also zero. It was a zero. And so that kind of lowers my risk factor for having a heart attack. Does that totally mean I can't have a heart attack or I will never have a heart attack? No, but it does mean that I don't have a risk for developing a heart attack as far as that calcium score. My scan was called the CT cardiac scoring without contrast. And my coronary artery calcium score, again, was a zero. So that means there's no evidence of plaque in your arteries. Now, I want to share with you what your score would possibly mean. So, if you have anything between a 1 to a 10, they say that's a minimal risk. If you have overall a score of 1 to 99, they consider that a very low risk. If you have a score of 100 to 299, that's a mildly increased risk. If you have a score greater than 300, that's a moderately increased risk. And if you have a score that's above 800, your risk has severely increased, and you need to seek help from your doctor and support from your doctor or a healthcare professional right away. Now, the highest possible score you can get is a 1,000. So if you are up near the 1,000, run, don't walk to see your doctor. Hopefully, this is something you can look into, ask your doctor about. Ask the doctor if there's something that would be beneficial. Now, I'm going to tell you, my primary doctor at the time never mentioned this test, and she was actually a little irritated that I had gone to another doctor, a holistic doctor, and talked with her. And it was just awkward. I was not expecting that at all. I thought she would be more accepting of it, but she really was not. And so she really didn't go over my results a whole lot more, which led me back to make an appointment with the holistic doctor, which is good anyway to follow up with whoever ordered your testing. And I followed up with her. She explained everything in the test for me. And so I would encourage you to do that as well. We pay a lot for, expensive things, entertainment, vacations. And so I say, why not put a little bit of money into your health? And preventing things before they happen is, what we all should be striving to do, not waiting until it's too late. And so if you know somebody that has had a stroke or a heart attack in the past, or somebody who is not in the best health, they don't necessarily have to be overweight, but not in the best health, or just somebody who you love and you just want them to check their score, I would suggest this test. Now, I am not a doctor, I'm not a health professional at all. So I would talk to your doctor before you take a test. One of the downsides, when I researched this test, some of the doctors I found that aren't promoting this test or don't recommend this test to their patients say they don't because you're at risk for being exposed to radiation. And so that was their concern. They also say that a lot of times when you take these tests, then they find a little bit of, plaque that has hardened, which is the calcium, and they find a little bit of calcium deposits that have hardened in your arteries. And doctors want to put you on statins or any other kind of medications. And so it's just a way to make money. So they make money offering these tests. And like I said, when I took the test, it was free. And so they were promoting taking this test. And so maybe that's true. I don't know. You would have to do your own research. I know there is a doctor, and I wrote his name down. His name is Dr. Alo. I believe that's how you pronounce it, ALO. And he does have a YouTube channel. And he does not recommend patients getting the coronary artery calcium test because he said that it can't really detect the kind of plaque that we should be detecting in your arteries. He says that our arteries have soft plaque tissue that you can't see. And he said a scan will not show this type of plaque in your arteries, which, so because it's not showing this soft plaque, which leads to more heart attacks, he doesn't see any reason why people should take this test. Now, I always say if there's a little bit of hope that it could find something or it could put something on your radar that wasn't there before, why not? That's just my thinking. But again, I'm not a doctor. You would have to talk with your doctor and make your own judgment. There was another doctor I ran across that was not advocating for taking this CT test. And somebody wrote in his comments, this was a different doctor. And the person making the comment wrote, the CT scan saved my life. 3 years ago, I had normal cholesterol levels. The doc said it was a waste of my money. 738 score. I immediately changed my lifestyle and diet. Lost 40 pounds, improved all my blood markers. Had I not gotten the scan, I probably would be, he said, dean by now, but he meant dead by now. There is a testimony right there of somebody who the doctor didn't recommend it. He saw his score, and his score prompted him to make those lifestyle changes to change probably the trajectory of his life. So somebody wrote back to that comment and said, unfortunately, it took you getting radiated to get motivated. And I say, if that's what it takes for that person to change their life and to get some test results back that's going to motivate them to change their life, then why not? But if you're one of those people that you're worried about radiation, but yet we're on our phones with radiation. I'm on a computer right now that probably is giving off radiation. A lot of high-tech things in my home are giving off radiation. We're exposed to radiation all the time. Do you want that extra? You probably are somebody who doesn't, and so don't take the test. But if you can take that risk to see what your calcium levels are, then I'm just giving you the information. You can decide to do what you want to do with it or not. So again, this was just a public service announcement. I am not a doctor. Please consult with your doctor before you order or take any kind of test. Before you do anything, make sure you have your doctor's approval. But I would definitely have a conversation with your doctor and talk about what are the pros and what are the cons of this test. And maybe you are someone that can get a score that would be relatively relatively high and decide it's going to change the course of my life. And so hopefully this helps someone out there. I just couldn't help but to give the information out. So thank you for watching. Subscribe to my channel. Please share this video. And remember, slow and steady wins the race. Just don't quit. Thank you.